Hello, and welcome to Lesson 4, the Affordable Care Act, Historical and Contemporary Stakes. In this lesson, we'll be learning about the Affordable Care Act and the movements that led up to it, as well as the current challenges and opposition it faces. By the end of this lesson, you will be able to better understand the role of racism in the creation and critique of the ACA. We'll also discuss the effects of COVID-19 and how legislation brought about by the unprecedented times we find ourselves in has made healthcare more accessible. In 1966, the American Medical Association was segregated, allowing entry only to white physicians. In response to this, Dr. Kim proclaimed in a speech that of all the inequalities that exist, the injustice in healthcare is the most shocking and inhuman. Years before, this medical segregation paved the way towards organized protest, which became a key component to civil rights strategy. This strategy led to the Civil Rights Act of 1964 and subsequent influence on the development of Medicare and Medicaid in 1965. These political and policy acts led to sweeping positive change in healthcare for people of color and the disadvantaged in general. Medicare's universal coverage of the elderly brought federal funding to many hospitals, and thus, under the Civil Rights Act's non-discriminatory clauses, effectively ended segregation in these institutions. As a result, hospitals became the most racially and economically integrated private institutions in the nation. Medicare is a federal program attached to Social Security. It is available to all U.S. citizens 65 years of age or older, and it also covers people with certain disabilities. It is available regardless of income. There are 4 parts to the program. This program includes Part A, hospital coverage, Part B, medical insurance, which are funded by payroll taxes and deductions from Social Security income. Part C is privately purchased supplemental insurance that provides additional services and through which all Medicare services offered by Part A and Part B can be accessed. And Part D is prescription drug coverage, which are paid out of pocket by program participants. In 2006, prescription drug coverage was added to the program to address the growing concern over skyrocketing drug costs. Medicaid is a program that is jointly funded by the federal government and state government. It helps low-income individuals and families pay for the costs associated with medical and long-term custodial care. The federal government funds up to 50% of the cost of each state's Medicaid program, with more affluent states receiving less funding than less affluent states. New York, for instance, is a more affluent state when compared to Alabama. There are strict eligibility requirements, and the rules vary by state. Medicaid is designed to help the poor as well as families, pregnant women, children, caretakers of children, the disabled, and the elderly. On March 23, 2010, President Obama signed comprehensive health reform called the Patient Protection and Affordable Care Act into law. This law was also known by many as Obamacare. The law included major provisions intended to make health coverage on the individual market more affordable. ACA put coverage standards in place to prevent insurers from discriminating against applicants based on an individual's pre-existing medical conditions or their gender. Even though this law has been held under much critique and scrutiny, primarily by the Republican Party, the law sharply reduced the number of uninsured Americans. The Affordable Care Act expanded coverage, controlled healthcare costs, and improved the healthcare delivery system overall. It extended Medicaid coverage to many low-income individuals in the 39 states that have expanded coverage. State governments were able to decide whether or not they wanted to expand coverage for its population, and some states chose not to. After 5 years of being signed into law, in 2015, the number of uninsured non-elderly Americans stood at 28.5 million, a decrease of nearly 13 million just 2 years prior. The Affordable Care Act has vastly reduced racial health insurance disparities and increased insurance coverage in general, but this has not stopped continued efforts to repeal the law. Many arguments have challenged whether or not the ACA is constitutional. The ACA is unpopular with the Republican political party, and Republican voters tend to view it as welfare, accompanied with all of the negative perceptions that carries. Many of the arguments center around distrust of the government and wanting to combat perceived government overreach, which they consider the mandates to be. Many conservatives object to the federal government becoming even more involved in the nation's healthcare system. And in fact, the law did increase the government's oversight of healthcare. When it came out, some liberal Democrats also did not like it, that it did not go far enough and gave too much power to private insurance companies. Out of the 12 states that have refused the ACA expansion to date, 8 of them are in the South. Historical analysis of this decision links this decision with racist beliefs prominent in the Jim Crow South about public assistance programs, which many liken Medicaid to. Southern states challenged the expansion in court and won, making expansion voluntary. To date, even though the ACA has reduced racial disparities in coverage, a disproportionate share of Black people do not have coverage, in large part because of Southern states' refusal to expand. Many states, even those that have adopted the expansion, have enacted legislation to opt out of certain reforms and provisions of the ACA. These legal challenges have made it harder for the ACA to reach its full potential and achieve its mission of expanding health insurance coverage to all Americans. In March 2021, U.S. President Biden signed the American Rescue Plan that temporarily makes healthcare coverage bought through the Affordable Care Act more affordable for millions of Americans. During the global pandemic caused by COVID-19, many Americans were in precarious positions without jobs or without jobs that provided health insurance. Many individuals found themselves laid off, and some employers were not able to keep insurance plans for their employees. The American Rescue Plan improved marketplace access and affordability by boosting premium subsidies for enrollees and protecting them from having to repay excess subsidies from last year. Under continuation of health coverage laws, laid-off workers can continue their employee-sponsored health insurance for up to 18 months with the 60-day sign-up window. This window was extended through the American Rescue Plan. Fiscal incentives are available to the 12 states that have not yet adopted the expansion, in which states can receive an additional 5% of the federal matching rate to the pre-existing rate of 90% for 2 years after the expansion takes place. The American Rescue Plan reduces premium tax credits at all income levels, meaning that the federal government pays a greater proportion of premiums relative to the existing ACA guidelines. We've discussed an important U.S. policy that has demonstrated an influence on disadvantaged individuals, while also showing how both historical and contemporary viewpoints of the policy are mired in troubling racist beliefs. While politics certainly continues to influence the ACA, we will discuss politics further in another module and continue to explore how politics differs from policy.